In order to understand anxiety disorder, it's first important to understand what anxiety is. Now, anxiety is a natural way that we all react when we're faced with an upcoming stressor or a concern of some kind that's coming in the future, so we need to be prepared to address it. So it can actually be a beneficial thing because it helps our brains and our bodies prepare to focus on the specific thing that we need to address. The point when it becomes a disorder, and what point when anxiety becomes an anxiety disorder, is when it becomes consistent and it becomes excessive to the point where it's really affecting how someone is able to interact with peers socially, how they're able to interact in a work situation, all types of environments that makes a difference. Some of the symptoms associated with anxiety disorders include excessive worry, sleep disturbances are pretty common. Other ones that people often don't think about are irritability, and the other piece that's very common is for people to have issues with concentration, so their mind goes blank when they're trying to come up with something. Types of disorders include generalized anxiety disorder, panic disorder is a type of anxiety disorder, social anxiety disorder, as well as a category of disorders including post-traumatic stress disorder and obsessive compulsive disorder. Now, it's not just the symptoms and how they affect someone that makes it an anxiety disorder, it's often how they react to that too. So just because someone worries about something doesn't mean they have an anxiety disorder. But for example, if someone has social anxiety, they may be afraid to go into social situations. So what happens as a result is they'll avoid that social situation, stay home. So it's how they cope with it that actually ends up making it an anxiety disorder. People often wonder whether anxiety disorder is caused biologically, whether it's just caused by the environment, and it's actually like most mental disorder, it's a combination of the two. Studies have shown that anxiety disorders run in families, so there's a genetic component to them, but there's also an environmental component, so including how someone's raised, as well as the stressors they're exposed to in their life, all impact how that anxiety disorder comes out. Anxiety disorders are something that do fluctuate. It comes in waves, so there'll be times when people feel high levels of anxiety, so if they have panic disorder, they have more panic attacks, and it affects them more. And there are also troughs when they're able to manage it, things seem fine, and it just seems like they're okay, even though they might feel some level of anxiety still. So in order to treat it, there are a couple of ways to look at it. One is around psychotherapy. For example, cognitive behavioral therapy is one type of psychotherapy that's been proven to work with anxiety disorders, but there's also medication that can be helpful for that. A person's faith can play a very important role in treatment. Most studies have shown that someone's religious involvement can be a protective factor, so it can help them feel hopeful, it can help them feel connected to other people, and it can help decrease their chance of feeling depression and feeling anxiety. So if someone is involved in their church, they feel accepted and feel like their disorders accepted and understood by their church, then it can be a huge place for them to receive support and a place for them to heal. When people think of an anxiety disorder, they often have this image of someone who's a shut-in, who's at home, is unable to go out and function in the world. But that's not how most people with anxiety disorder actually come across or what their experience is. Often there are some people with anxiety disorders who have a hard time going out in social situations, but they're able to hold down jobs, they're able to do other things. But anxiety disorders and the way people deal with them come across in two ways. One is someone who withdraws from the world and shuts down, is unable to cope with some of the things that are going on. But the other extreme of how an anxiety disorder come across is someone who becomes over-controlling. So this is a person who is very rigid, has to be very scheduled, and very organized in everything that they do. The only issue with that is, even though that can be helpful, there's a point when if anything goes outside of what they have scheduled, outside of what they have on their planner, they tend to fall apart, they tend to get very irritable or unable to cope with it. So those are the two extremes that you can see in terms of how people deal with anxiety disorder. Obsessive compulsive disorder is a great example of the latter one, where someone goes through rituals that are very controlling, that are very strict, like turning a light on and off, or washing their hands repeatedly. And any of those things, making sure your light's off, or just washing your hands to make sure there aren't germs, is great. But when it gets to a point where it becomes ritualized, where it becomes so repetitive that it's actually damaging to the person, that's when it becomes an anxiety disorder. When a clergy member sees symptoms of anxiety within one of their congregants, I think one of the first things that's important for them to know is that people with anxiety disorders or even high levels of anxiety don't know that they are experiencing an anxiety disorder. Often they think of themselves as weak or being incapable of handling life. So the first thing that a clergy member needs to do is approach them and talk to them about the idea of what an anxiety disorder is. I think the next step after that is to see if that person's open to treatment and to just let them know that there are avenues for treatment, both medically and through therapy, that can be really helpful to them. And the fact that their faith can also play a role in them getting better from their anxiety as well.